Hey, I'm Dr. Ryan here from Infinite Wellness Integrated Medical Center here in Glen Carbon, Illinois. One thing we just want to do is show you our office. Make you feel at home when you get here. That way you know where everything's at, you know what we do, how we can help you, and just give you an idea of what we're all about. So come on in here, I'm going to show you the office. So we're located at 220 Evergreen Lane in Glen Carbon, Illinois. We try to play it safe, as you see right now. You put on your mask when you come in. So just going to keep that door open there. So as you can see, we're here in the reception area. You know, our goal is to make you feel welcome. Our goal here at this practice is to make you feel like family and to help you understand that we're here to help you and not to do anything more than that. We want to help you reach your goals. So as you can see here when you walk in, we try to have a nice facility. This is where our front desk staff's going to greet you, always with a smile because, again, you're family. When you come in here, we care about you and we love you. You can see here on the walls here, we have our core values and what we're all about. We try to always be honest, be innovative with our care, compassionate, always trying to see where our patients are coming from, and also we want to, very importantly, we want to be effective with our care. It's not just about you getting care, it's about you getting results. And as you can see over here on this side, it just talks about our mission, just what we're here, why we're here, and what we're trying to do for our community and for all the people in our community. You know, our goal is, like I said, to be innovative, effective, honest, and compassionate. And so we'll come through here. I'm just going to show you how. So first, we're going to greet you here. We're going to get all the paperwork done that needs to be done, check insurances if necessary. We're going to do everything that we can to make sure that we have all the paperwork, the HIPAA, all of those documents done and ready to go. So that way, all of those things in the back office are taken care of right away. And so head on back here, as you can see, we have a beautiful wall here. It's pretty cool. But then the office starts. This is when we get into the care area. So over here is our medical area. We're going to walk back through here. This is where our medical providers, our medical doctor, our nurse practitioners, this is where they reside most of the day. And so I'll just show you this little corridor here. So we have 3 rooms back here. We have one of our exam rooms here. This is our new patient exam rooms. We also have a piece of equipment called a TM flow. We can walk in here and I'll show you what that's all about. So one of the things that we take care of a lot of times are people with peripheral neuropathy. It's a devastating disorder and it's very important and near and dear to our hearts to help people that are dealing with this. So one of the pieces of equipment that we have is this TM flow here. It's a computerized piece of equipment. And basically what it does is it tells us basically how well the blood is flowing through your lower extremities and through your upper extremities. Also too, it tells us how well the nerve conduction is going. Because if you have that small fiber neuropathy, this is going to help us detect that. So you can see how this room, again, we have our core values because, again, it's near and dear to our heart that every patient that walks in this door knows what we're about. And so you can see back here, we have, this is our procedure room from our nurse practitioner medical doctor. This is where we do a lot of, in most of our injections, things like platelet-rich plasma, allograft tissue containing stem cell. We do a lot of trigger point work to help to deal with anything from neck and back pain, knee pain, joint pain, you name the joint, also muscle pain, trigger points, just pain in general. You know, we're not a pain management clinic by any sort of the imagination. We're a pain fixing clinic. We're not trying to manage your pain. We're trying to help you figure out a solution for your pain. And that's, again, very important to us. And so this is what this room is for. This is where we store a lot of our nutritional IVs, etc. And this is just another exam room here, similar to our TM flow room. Nothing, you know, nothing out of the ordinary, table, things that we can do a full exam, orthopedic exam, etc. Because again, what our goal is here in the practice is not to just, you know, run you through the process, get you in and out of here as fast as possible. We want to sit down and talk with you. We want to figure out what we can do, because if we do our work on the front end, we're going to have way better solutions and a way better idea of what you're dealing with, and that's huge to doing the right type of care, and that's very important to us. And so as you can see here, we have a big corridor here. This is kind of the main artery of the practice. This is where patients come and go from both our physical medicine and our medical side. Also in here are IV nutrition and neuropathic treatment room. You can see here we have a glass wall, which is really nice, so we can see through here. We can see how our patients are doing, but also help with sound. And so you can see here we have some equipment that we use for our neuropathic patients. And we're just seeing phenomenal results with this, and this is extremely exciting because it is such a debilitating disease and disorder for a lot of folks. So the sooner that you can catch that, the better, because the faster your treatment will be. And over here we do a lot of nutritional IVs. We also pull our PRP in here most of the time. And so again, PRP is that platelet-rich plasma where you use your own body's cells to help your body heal and also get out of pain, because they work better than steroids, which most people now in the medical world, they're doing mostly steroids, and unfortunately that's not good for your body. And also too, like I said, we're not managing your pain, we're not just covering it up, we're trying to help your body fix that pain. And so that's why this area back here is so important, because when we're talking about biomechanics, we're talking about joints. Joints are designed to move, and the body is designed to move and heal. And so we've got to make sure it's healing properly. And so what we do, we have all sorts of different methodologies that we do, whether it's the spine, whether it is a shoulder, a knee, even those nerves, we have specific pieces of equipment that we utilize to make sure that your body is functioning, healing as best as possible. So we do chiropractic care, we do rehab where we're running through exercises, physical medicine, etc., trying to find deficits and strengths and trying to balance out the body. And so you can see here, it's a beautiful office. We're extremely excited and happy that we have this office. Over here is the restroom. And I apologize, I didn't show you our little coffee bar back there, but we just passed that up. You can see that with the white tile. So if you, again, we want to make this feel like home. And so we have water, coffee for our patients, just to make sure that, you know, if a husband or wife is sitting out front waiting or whatever it may be, they can have some of those creature comforts. So I'll take you back here. You can see it's a nice bright office. We have beautiful colors. But again, our goal is to make sure that we're getting people healing, and so that's why we're always trying to have the most cutting edge equipment and also therapies in our office. So I'm going to take you back here, just a couple other areas. So we have our vibration plates here. We utilize this a lot for nerve issues, for postural issues, etc., to help to correct the spine, to help to wake up those nerves. And then you can see back here, we have, this is our, we won't go in there, but this is our x-ray suite. This is where we have digital x-rays, because we take pictures of any type of problem that we feel we need to see deeper than. Because ultimately, obviously we want to hear what's going on with your body, but we also want to make sure that we can see those bones, see those joints, see how they're moving, see if they're broke down, check for arthritis or arthritic condition, misalignments, etc., that could be causing your problem, things that we can ultimately help fix. So as you can see, we do all sorts of things. We just wanted to show you our practice because we're extremely proud of what we do. We're extremely excited about what we do, and we're extremely excited that, you know, folks like you out there are looking for better options than the standard pain management, the standard care that so many folks have gone through for decades, and it's never changed. What we do in this practice is revolutionary, in my opinion, and it's cutting edge. It's just things that are not happening in most healthcare facilities, and that's why we get the results we do. That's why we know everything that we do in our office is to make that person better, to help their health, never to just mask a symptom or cover up their pain so that it gets worse and worse and worse without them feeling it. And so we're just happy that you watched this, and we hope to see you soon, and God bless you and your family.